So, Dr. Nyonator, welcome. It's wonderful to have you at the Harvard School of Public Health. You have been in the health ministry in Ghana for goodness knows, I'm not sure how many years, but probably more years than you care to recall. But I want you to think about those years and the time that you have spent there, particularly in your position as Director of Policy and then as acting Permanent Secretary in the last years. One of the aspects that ministers, I think, concern themselves most about when they're coming into office, and you saw quite a number of ministers over the years come and go, is how they, A, will be received by the civil service, and B, how will I manage the civil service? And so my first question to you is, would you have a suggestion for the minister on their first week in office for how they conduct that opening chapter? Because I suspect that it's that opening first week that sets the tone for the rest of the term.
Exactly. Yeah, well, as you said, I've spent a whole lot of time, especially at the Ministry of Health in Ghana, at the headquarters, and I've seen quite a lot of ministers come in and go. And in Ghana, we sort of have a turnover rate of maximum 2 years per minister, so you can imagine the number of ministers that I've seen. And clearly, my advice to the ministers from my own experience is basically that there's a structure at the ministry that needs to be recognized. The structure includes the civil service structure, which has technocrats in there, and they work according to set regulations and set guidelines. Most ministers come in with, I guess, some ideas as to how to manage the ministries. I've seen quite a lot of ministers coming in and getting advice, not within the ministry, but from outside the ministry, from political circles, as to this is how you have to handle the civil servants, the technocrats that are there. My advice would be, as a minister, you are in there to get government policy agenda through. So you have to get the technocrats on board. So the first thing you need to do is to meet with the technocrats, ask about the plans and the agenda that is there, and how you want them to fit into government's political agenda. But if you don't do that and you come with your own agenda, and invariably from my experience, some people will get to the minister the first day or two and say, this person is not good. And it happens that then the minister then forms his mind. And once he forms his mind, he starts taking decisions and sidelining some and working with others. But there's a team. There's supposed to be a team at the headquarters that needs to be harnessed. The other thing is that I've seen ministers coming in and they are in a hurry to go out politicking and talking to the institutions. I've seen so many examples of a minister coming the first week and say, well, I want to go to this hospital or that institution. Yeah, we want to make our agenda felt out there. The danger is that they don't know what is in the ministry. So when they get there are requests out there. Some want buses, some want this and that. And then they start saying that, well, we'll provide you with this, I'll provide you with that one. When he doesn't know where the resources will be coming from. And so it becomes a bit difficult for them. And that's what I call self-destruct buttons. And that has happened to quite a lot of ministers.
So ministers come with a political priority, and oftentimes that is, we need to make these hospitals look better because people will love us for doing that, without a thought about whether that is in fact a priority in the context of the overall health budget and whether the resources are even there. The other thing which I suspect happens is that some ministers come with a big bright idea. You know, now we really should be doing this. This should be our priority over here. And my question is really not to say that ministers shouldn't come with big bright ideas. It's great to hear a minister with a big idea, but how would you advise the minister to position the big idea so that the civil servants don't immediately try and obstruct?
Well, again, in any human endeavor, you may have ideas, but you need to have the team buy into that idea. And first, the starting point is meeting with your technical staff at the headquarters, the ones that you are going to work with, the management that you are going to work with on a day-to-day basis. And they are the ones who will take those bright ideas out for you, not you yourself. You might be articulating it on the political platform, but the bright ideas will be translated into activities by those political and technical people. So it would be good to spend some time to discuss those ideas with the technical people. Again, there's no way that you can work without involving the technical people. So,
does it happen? In your experience, is that what's happened?
Well, some again, I'll go back to pressing the self-destruct buttons. When you don't discuss your bright idea with the technical team that you have, and then you go out there maybe to a district or a region and start articulating that, giving instructions. The question is, who will take those instructions? You have to work through people. As a political appointee, your duty is to steer the activities of the ministry towards that bright political ideas. So you have to work with people.
Do you think, I often hear ministers, particularly new ministers, complain that they feel that they're being obstructed by the civil servants. My question is that real or imagined?
Well, it can be real. It can be real. But then again, it depends on how you as a minister, position yourself in the first few weeks that you enter the office. If you give an indication to the team around you that you want to work with them, you will find at least 80% or more will be willing to work with you. It depends on how you position yourself and your own body language for a human institution like the Ministry of Health. Yes, people will be watching the first 2 weeks how you even greet them. You greet them.
Whether you remember their names.
Whether you remember their names, how warm you are with them. So, and those guys have a lot of experience, a lot of ideas to turn your bright ideas into workable ones or even to shoot them down. So yeah, for me, I think it depends on how you position yourself. 80% of the people who work with you. You might not get everybody on board, but once you get the majority on board, eventually those who are not with you will turn around with you.
There tends to be, and some ministers mix the model, but there is either a managed by authority or managed by motivation approach. In your experience, did most of your ministers manage by authority or by motivation?
I would say that as far as I can remember, in the first place, the best ministers that I have worked through in my own personal experience are non-medics. And these are
interesting.
These are people, and the two that I have in mind are even non-medics and service personnel, or military personnel. Yeah.
Because they understand the command structure.
They understand it. And interestingly, they are the ones that said, look, we are here not to tell you what to do, but you tell us what we should do. And so these two guys got the technical teams together, and then they provided advice to them, and they then take it up And I remember one was very, very successful. Unfortunately, he's passed on. And I supported him throughout his stay. He was a member of Gavi board, international institutions, and I was always by his side providing him with advice, and he takes advice. That is somebody who is listening.
Yes.
Unlike somebody, the medics, when they come, they think that they know, and so they go,
come on.
Come on, and they are the ones that incidentally provide the command or the, the instructional kind of leadership, which doesn't work in the organizations like Ministries of Health, which is civil service, rooted with ground rules. No.
Ghana is best known at the moment, I think, for being a pioneer in Africa in national health insurance. And without getting into the whole details of national health insurance, what I do know is that national health insurance was a political idea. It wasn't necessarily an idea that grew out of the ministry. You were there in a very central position at the time. How did you take that on board?
Well, it's quite interesting. The idea came not initially from the politicians, from technical people who look at the situation now and financing healthcare and the problems that we're facing at the basic hospitals and health center levels, where people were absconding and people were not accessing services. So the idea was to see how best we can use structures that are on the ground.
This was the technical side of it.
Yeah, technical side of it. Structures that are on the ground to really boost up what we call community-based insurance schemes. So we had schemes like SUSU schemes that are credit schemes that we thought they could be turned around to have some health provision schemes into them. And so then it moved on for us to have community-based self-insurance schemes. These were technically directed. And then the two big political parties started claiming ownership that this is it. And so the first political party decided that, look, we will tap on this and improve on it. And we will make sure that we get health insurance installed in Ghana within the time of their, what they call governance. And so they practically bulldozed their way through the legislation.
Because they saw it as a good political platform. Yeah,
they had made, before they came into power, they had made a promise to the population of Ghana that they want to remove what we call the cash and carry system, which was a user fee system per se,
right.
And that claimed a whole lot of casualties. So the political party used that one as a political campaign promise that they will set up a national health insurance using the existing concepts that are on the ground from the technocrats. So when they came into power, they pushed that agenda through amidst protestation from everybody, including the medical associations, the labor unions, and basically because most people felt that the concept was not well defined. It has not been practiced anywhere, and so it was not going to work.
But politically it worked.
Politically it's working.
It's been popular.
It's working.
And now it's not a political dispute. All the parties support it, is that right?
All the parties necessarily support the rollout insurance scheme. And so it was not an issue of whether either or situation. It was more of which party takes the most political gain out of it. But technically, the technocrats have supported it to work. But the issue is that we are learning by doing. Clearly, we have about 37% coverage now, when we had projected that by now we should be getting to 80% coverage, which incidentally is quite ambitious for a country like Ghana. But yes.
So what does the minister say when you tell the minister exactly what you've just said? Minister, I'm very sorry, we're at 37% and not at 80%. Do they understand the problem?
Well,
the challenge?
Incidentally, the current government has been in power for 2 terms now, and we've been telling them the same story, that we have challenge in enrollment. Challenges in enrollment, that people are not enrolling as we envisage. The tendency is to, okay, so why is it that people are not enrolling? Why is it that you're not getting them? Is it the premium that they have to pay? Okay, if this is the premium, then let's institute a new way of doing that. And we are coming out with what we call one-term premium, which is, everybody is wondering what exactly that is. One-term premium in health insurance is something that has not been tried in before.
What do they mean by that?
One-term premium, you pay once and then you don't pay any premium for your lifetime.
Oh, wow.
So the rest of your time, your life, you pay once and then you are a member for life. Now, there are protagonists that are saying that that is not going to work. Government itself is also struggling to see how they can implement that one. That's also quite interesting. So that kind of policy has not been well thought through. And so, but yet still, it is on the agenda that we have to implement it.
And did you find that, and this is now, what, 5-6 years that the National Health Insurance has been implemented, so how many ministers have been there over that time? Did you find that some ministers were more astute at taking lead in advocating for national health insurance than others? Or did most just allow you to get on with it?
Well, the party that actually initiated the law vigorously claimed ownership and kept on defending the original concept. And so a minister within that party, within that government, who said that, Lord, let's go back to basics.
Okay.
But then the other party will also say, no, but the concept is not well defined. We're now trying to redo it. So, I mean, clearly there are pros and cons of the arguments on either side. But the essential thing is that, yes, we are learning by doing, so we are tweaking as we go along.
And they buy that, they accept we're learning as we
Yeah,
go.
well, it's not easy to scrap something that has been put in place. You might have your own ideas, but it takes another effort to change that system that has been put in place. So yes, it's not really an issue of trying to do away with the health insurance. It's an issue of, oh, okay, we could have done it this way, or we could have done it that way. But with all those arguments, it's really not an issue of changing what is on the ground.
If you were in the position to be able to advise the minister in a personal way as the minister is preparing to become minister, would you suggest minister go for the legacy, or would you suggest minister just be a good manager? Or can the two live together?
When you say legacy, actually...
In other words, put your stamp on this place so that when you go, minister, they will remember, aha, you were here, you did things differently, versus just managing what is already there.
I think you have to blend our advice for blending of the two. Basically, because now I have to tell them the stories of those ministers that I think had performed well. Their legacies...
What are the attributes of ministers that have performed well, do you think? What would be the 3 or 4 things?
Minister who listens, a minister who seeks advice, a minister who try to move people together, not going alone, and a minister who doesn't go out there in the open and say, I'll buy you a truck.
You can build you a new hospital.
And we have a lot of ministers that do that, go promise, then they come back and say, well, okay, so where do we get the money from? And that is interesting. Meanwhile, the budget is already fixed, so you cannot do anything about it.
Yeah.
So a minister who is humane, who is listening, who is really people-centered and management-centered will be the one that I will be advising. So don't bulldoze your way. Get consensus over time and then move forward.
And build your legacy with
build,
that way.
Exactly.
Yeah. Well, it's a pleasure talking to you, Frank. Thank you so much.
It's indeed a pleasure to be with you.